Now, in zone 3 injuries or for other injuries, there are further modifications. One is regarding how the fracture pattern is. Okay, the fracture pattern can be U type, the fracture pattern can be H type, it can be Y type, this one, it can be lambda or even a T. Okay, now all these are for not a pure vertical fracture. Now, in many of the sacral fractures, it is not that the fracture is only one, like how the Dennis classification tells us, right? So the fracture line can have multiple orientation, like we have a vertical line along with the transverse line, or a vertical line with an oblique line going to the opposite side. So all those happen, and that just adds on to the instability, and hence this morphological classification where you talk of the how the pattern is U, H, Y, T, lambda. So you just describe the fracture. So this tells us that there is a transverse element also, or an oblique element also, in addition to a vertical element. Okay. And Roy Camille, what the classification, what it tells us, it further subclassifies zone 3 injuries. Okay. That is the medial fractures, medial to the sacral foramen. And these are CT based classification, and it tells us what has happened on the CT. Okay. So it divides into basically 3 types. The fourth was a modified Roy Camille classification, which was added on later on. So the type 1 is there is a fracture and only an angulation, a kyphotic angulation. In type 2, there is an angulation along with that a retrolisthesis, that is a posterior displacement of the proximal spinal column. Type 3, we have an antrolisthesis with the angulation. Type 4, there is no angulation, no listhesis, but there is an impacted fracture, a comminuted or an impacted fracture of the sacral, one of the sacral bodies. Okay. So that is the Roy Camille classification, which is a further classification of type 3 Dennis classification.